This will happen to all of us. You start to notice that you can no longer read things up close anymore, and you have to start holding small frames further away to read them without straining your eyes. The problem may be more pronounced when you try to read in poor light when you are tired, and this condition is known as presbyopia. Presbyopia typically comes noticeably in your 40s and gets progressively worse over time. In today's video, let's summarize the pathophysiology of presbyopia and how we can manage it. Let's take a look. When light enters your eye, it passes through the cornea. It then enters through the pupil. The iris is the color ring in your eye that controls the pupil and adjusts the amount of light entering your eye. After passing through your pupil, the light gets refracted by the crystalline lens. The shape of the crystalline lens is controlled by the ciliary muscle. When looking at faraway objects, the ciliary muscle relaxes and the lens becomes flatter and thinner. To see close by things clearly, the ciliary muscle contracts and the lens becomes curved and thicker. This raises the refractive power of the eye and allows you to focus on nearby objects. A healthy lens should be flexible enough so that the eye can focus on things at all distances. This process of changing the refractive power of the eye is what we call accommodation. While the difference between the refracting power of the eye when adjusted for far vision and when adjusted for near vision, or, to put it simply, the maximum potential increase in optical power that an eye can achieve in adjusting its focus is what we call amplitude of accommodation. As we age, the crystalline lens slowly gets stiffer, meaning that it becomes less efficient at bending to accommodate changes in focus. The problem is compounded by the gradual loss of strength of ciliary muscle. As a result, the lens loses its flexibility and hence-wise, down goes the amplitude of accommodation. So you will have trouble focusing on things close up, while your ability to focus on things distant objects is unaffected. So presbyopia is also called age-related farsightedness. The lens stiffening begins in childhood. Toddler eyes can focus on objects basically right in front of their eyes. This ability is lost gradually as we grow older. A 10-year-old on average has 14 diopter of accommodation, so you read text on a paper even if it's really close to your face. But accommodation will decrease to 4.5 diopter at age 40, 1 diopter at age 60, and essentially to 0 in the 70s. So the distance you need to keep between your face and text in order to see clearly becomes further and further, while you're finally starting to affect our standard reading distances roughly in our 40s. Generally, almost all of us will need reading glasses at around age 45. From there, presbyopia will continue to worsen until we hit our mid-60s. Presbyopia is a normal and inevitable process of aging, and all of us, yes, I said all of us will have to deal with reading glasses sooner or later in our lives. This condition occurs regardless of whether you are nearsighted, farsighted, or astigmatic, or emmetropic. As one becomes presbyopic, he will have to extend text out further in order for him to see, or he may find himself constantly leaning backward, and he will also realize that he needs stronger lighting for him to see, because under stronger lighting, pupils become smaller, which increases the depth of field and compensates for presbyopia. He will also likely suffer from eye strain because his ciliary muscles are working so hard for him to see. Some presbyopes can even show symptoms of eye pain, tearing, and headaches when reading. The general age of onset of presbyopia is at age 40, but some people may notice symptoms younger. Premature presbyopia can be a sign of underlying health conditions such as anemia, cardiovascular diseases, diabetes mellitus, multiple sclerosis, poor blood flow. You are also at risk of premature presbyopia if you are a female, have had intraocular surgery, and regularly take alcohol, antidepressants, and antihistamines. Another important risk factor for premature presbyopia is excessive amount of close work. If you are a programmer, a designer, or a surgeon, let's say, then the close work you have been doing will impose more demand on your eye's accommodation and lead to earlier presbyopia onset. Your refractive error also plays a role in determining when you will become presbyopic. Amateur will always become presbyopic earlier than myope, while your hyperope will always become presbyopic earlier than amateur. This is because glasses are around 12 to 15 centimeters away from one's cornea, and concave lenses' prismatic effect reduces the accommodation demand of your eyes. While for hyperopia, the opposite is true. Convex lenses increase the accommodation demand. Also, myopes who wear contact lenses become presbyopic sooner than myopes who wear glasses. This is because contact lenses don't have the same prismatic effect as glasses do. For hyperopia, again the opposite is true. Hyperopes who wear glasses become presbyopic sooner than those who wear contacts. Oh, I forgot to mention that contrary to popular belief, myopes do become presbyopic, unfortunately, but as long as they don't need an unusually high prescription, then they can overcome presbyopia by simply removing the spectacles when they read. So, how should we treat presbyopia? While there's no cure for it, many treatment options are available to improve your vision. The most common remedy for presbyopia is, of course, reading glasses. If you have an otherwise normal vision, then you can get non-prescription reading glasses. Many drugstores and supermarkets sell inexpensive reading glasses. Have your ophthalmologist perform an eye exam before purchasing a pair of reading glasses, so you will know which ones to buy. Keep in mind, however, that the two lenses of the readily available reading glasses are of the same power, while you may have a different vision in each eye. If you already wear glasses, then you may need two pairs of glasses, one for distance and one for close work. You might also consider bifocal or progressive lenses. Bifocals have two different areas of focus with a noticeable line between them. The upper portion of the lens is set for distance, while the lower part is set for close work. However, bifocals generally have a blurry intermediate vision. If you need good vision at all distances, then you can use progressive lenses. Progressive lenses don't have a visible line, and they offer a more gradual transition between the distance and close portion of the prescription. If you wear contact lenses, then multifocal contact lenses that combine several levels of adjustments, bifocal, trifocal, or progressive, are also available. Another option you have is to wear regular contact lenses and then wear reading glasses on top of it when you read. Recently, there's even an eye drop called VOD that was FDA approved for presbyopia, which can replace your reading glasses for 6 to 10 hours every time you use it. I can actually do a video on VOD explaining its mechanism of actions if you're interested. For some people, wearing spectacles can be annoying, and monovision or blended vision is an option to reduce the dependence on corrective eyewear. Most people have a dominant eye, whose signals are more quickly received and processed by the brain. With monovision, the dominant eye is corrected for distant vision, while the other is left nearsighted for close-up work. This might sound complicated, but many people adapt well. This technique allows them to see clearly at all distances and eliminate the need for glasses. If you are considering monovision, try monofocal contact lenses first and see if you can adapt. Keep in mind that since one eye is sharper than the other at certain distances, then your depth perception can be affected. Talk to your doctor if you want surgical procedures to eliminate the need for contact lenses. Laser surgery techniques include laser-assisted in situ keratomyelitis and photorefractive keratectomy can be used to correct a non-dominant eye for near vision and dominant eye for distance. It may take several surgeries to get a desired result, and the result may not last. Talk to your ophthalmologist and they can thoroughly examine your eyes and discuss your vision needs to help you find the best option. Alright everyone, thank you for watching. If you like this video, please hit the thumb up button for me and visit other cool videos on this channel. I have a question of the day. Do you know someone who has presbyopia? Which vision correction option do they use? Do you wear glasses, contacts, or have undergone refractive surgeries? Put them in the comment section below because I would like to know. If not, I will see you in the following video. Have a nice day. I'm signing out.